Hello everybody, we'll talk about the immunity, the ability of your body to fight against the antigens that try to harm your body. So antigens try to harm your body and your body has the ability to stop them and destroy them. That ability of your body is called immunity. Okay. Now antigens can come from outside. We all know that microorganisms like bacteria, virus, right? They try to invade into your body and harm your body and cause diseases. So your body will fight against them. So that is one type of antigen that comes from outside, from outside of the body. Okay. However, antigens can be produced inside your own body. Okay, and can try to harm. Example, antigens produced inside the body uh, are cancer cells, abnormal cells in the body, tumor cells, right? These cells are your own body cells, but they are your enemy, harmful for the body. So your body will also try to destroy them, will fight against them. So that ability of the body is called the immunity. Okay. Now your body gives two types of immunity. One is called the innate and another is called the adaptive. Okay. So there are two types of immunity. One is called the innate immunity that we get by birth. All of us, we get the innate immunity by birth. So it is same in everybody's body. And another type of immunity that develops after birth when we get exposed to antigens. So that is called adaptive. Adaptive is also called acquired. We acquire it when we get exposed to certain antigens. So you see, your body produces or develops adaptive or acquired immunity when you get exposed to an antigen. So this one could be different in different person. So it may varies person to person because someone might have exposed to swine flu virus. So that person has the adaptive or acquired immunity against that virus in his body, right? Uh, However, if you didn't get exposed to that virus before, your body doesn't have that adaptive or acquired immunity. It didn't develop in your body, right? So it varies person to person, and it depends on your experience with the antigens. So innate immunity includes the skin. You all understand that we get the skin by birth. Everybody has the skin that covers the whole body, right? And by covering the body, skin protects your body. So the microorganisms or antigens from outside of the body cannot get into the body through the skin. Okay, so this is innate. Uh, now, if the antigen tries to enter into your body through the respiratory tract, we inhale the air all the time, right? So microorganisms are getting in to the respiratory tract, inside the nasal cavity, inside your trachea, larynx, pharynx, right? Bronchi. In the inner lining of the respiratory tract, the layer is called the mucosa. So that mucosa, inner lining of the respiratory tract, will also try to stop those microorganisms will try to enter through the respiratory tract. Make sense? So mucosa of the respiratory tract. So mucosa. Also, the microorganisms or antigens can try to invade into the body through the food that you eat, right? So that is another way they can easily enter into the body. So in the inner lining of your GI tract, for example, from the oral cavity to all the way to your large intestine, the inner lining of your GI tract, you also have mucosa. Okay, and that also tries to stop the microorganisms or antigens uh, from entering into the body through the wall of the GI tract. Okay, so GI tract, gastrointestinal tract. So the mucosa of your respiratory and gastrointestinal tract or GI tract and the skin, those are the layers that would try to stop the antigens first, right? So these are called first line of defense of the body. Okay, makes sense. So they will try to stop first, and first line of defense will try to stop any kind of antigens. It is not selective, right? It will not say, skin will not say that I will try to stop this virus, but I will let this another one go. It will, try to stop anything. So it is not specific, non-specific. Same is mucosa. Now, if somehow the antigen manage to pass through the first line of defense, then they will enter into the tissue under the skin and mucosa. So they will enter into the tissue. Make sense? And then tissue will try to destroy them. Inside the tissue, you have certain uh, components that will try to destroy the microorganisms. What are those components? You have tissue macrophages, the phagocytic cells, probably you already know, and other phagocytic cells in the tissue. Then in your tissue, you also have antimicrobial proteins. Antimicrobial proteins. Okay, they will try to destroy the microorganisms. So in the tissue, you have the macrophages. Those are phagocytic cells, will try to engulf the microorganisms or antigens. You also have antimicrobial proteins. That protein will try to destroy them. Okay, and you also have certain enzymes. Okay, so all these are present in our body. We get these by birth. So these are called second line of defense. Make sense? So if first line fails, then second line will come forward. It's like, in the battlefield, that soldiers used to stand in different layers or lines. If first layer or first line is, destroyed, then second line will come forward. Okay. So all these are present in everybody's body. So innate. They are already there even before the microorganisms try to invade. Then adaptive or acquired uh, is developed after we get exposed to the microorganisms or antigens, and adaptive or acquired immunity is given by the lymphocytes. T and B lymphocytes, those are heavily trained, right? We talked about that. The trained lymphocytes, one type of white blood cells, T and B cells, or T and B lymphocytes. Okay, so that is one. And also antibodies. Antibodies. These belong to adaptive or acquired. And innate, now you already know that innate is non-specific. However, adaptive is highly specific. Why? Because I told you that the immunity will be developed when we get exposed to certain antigens. So highly specifically, your body will produce antibody against that particular antigen. If you get swine flu, your body will produce specific type of lymphocytes and antibodies to destroy that particular type of um, antigen. Other person's body won't have that. So that is highly specific against specific antigens. Highly specific, okay, because it is developed to fight against that particular antigen. Okay, so that is how first we divide the immunity, two types. Okay, then the adaptive or acquired immunity is further divided into two types. Okay, one is called cellular and another is called humoral. Okay, so adaptive cellular and humoral, cell mediated and humoral. Cellular is given by the T cells. So T cell mediated immunity is cellular immunity. Humoral immunity is given by the B cells, and you know that B cells produce antibodies. Antibodies. B cells produce antibodies, and B cells, another type of B cells called plasma cells, produce plenty of antibodies. Okay, so that's why it is called humoral. Antibodies are secreted into the fluid. So humoral means fluid. Aqueous humor, vitreous humor, the fluid inside the eye, right? So fluid where you have the antibodies present. Okay, so cellular and humoral. Now antibody mediated or humoral is divided into two: the active humoral and passive humoral. So active and passive. Active is your body produces antibody in response to any antigen. So active means your body produces antibodies actively. When your body gets exposed to an antigen, that triggers the production of antibody in your body. Okay. Passive means your body is not actively producing antibodies. You are getting antibody from outside. Getting antibody from where? Outside, because your body is not producing. Your body cannot produce or is not producing. So you have to get antibody from outside. So that is clearly, different than active. In case of active, who is entering into your body? Antigen. Okay, and that is triggering the production of antibody. So your body is producing antibody in response to antigen. In case of passive, your body is not producing antibody, it is getting antibody from outside, ready-made. Now active and passive both could be natural and artificial. So this is also passive, could be natural and artificial. Okay, so both active and passive could be natural and artificial. Now let me give you an example of each of these. Okay, so let's go here. Active and passive. Okay, active natural, artificial. Same, passive natural and passive artificial. Okay, now let me give you an example of each so you will understand. Active, natural is if any bacteria or virus tries to enter into your body, then your body will do what? Will produce antibodies against them, right? So bacteria, virus, those are natural microorganisms. They come from the nature. We don't produce them. So your body, in response to these antigens, your body will naturally produce antibody. Make sense? Against these microorganisms. Artificial vaccine is a good example. We get the shot of vaccine. Vaccine is actually what? So the vaccine, we get the shot of vaccine. Vaccine is actually highly suppressed antigens. So highly suppressed or highly attenuated or highly inactivated antigens. So basically vaccine is made of antigens. However, these antigens are what? Highly attenuated or suppressed or inactivated. Okay, so when you inject the vaccine or antigens, they will trigger the production of antibody in your body against that particular antigen. However, these antigens will not be able to cause harm or disease. Okay, so highly inactivated, but they must be able to trigger the production of antibodies. Antibody, but will not cause any harm. Will not cause harm. So that is vaccine. Okay. So now you see that vaccine also triggers the production of antibody, but that is artificial. We create the vaccine, produce the vaccine in the labs, right? So those are active. Now passive, your body is not producing antibody but getting from outside. That is passive. Passive natural, good example would be mother's milk. Okay, mother's milk. You know that infant or baby gets mother's milk, and mother's milk has certain antibodies. Milk has antibodies, and the baby gets the antibodies from the mother's milk, right? So that antibody helps the uh, immunity of the baby or infant. So that is natural, right? Baby gets mother's milk and that has antibodies. So infants and in a very early stage of your life, the immunity is less, so that helps the baby. So that is natural passive. Artificial passive, uh, just think that your immune system is not strong. It cannot produce enough antibody to fight against any antigens. So what you will do, you'll get antibody, or will give that person whose immune system is not strong to fight against any antigens. Then we will produce the antibody outside of the body and inject the antibody into that person's body, because that person's body cannot produce antibody enough. For example, AIDS patient, AIDS, acquired immune deficiency syndrome, and AIDS virus attacks the immune system of the body, right? So the immune system is destroyed by AIDS. So that person's body cannot actively produce antibody. In that case, he will not be able to fight against infections or microorganisms. So what you will do, you will inject the antibody directly into that patient's body. Okay, so that is artificial passive, right? So that's how we classify the immunity in the body. Okay, so first, immunity has two branches, two types, innate and acquired. Innate gives first line and second line of defenses. Adaptive or acquired gives the third line of defense. Okay, this one gives third line of defense. So we have three lines of defenses. Then adaptive could be cellular and humoral, and humoral could be active and passive, and each type, active and passive, has two divisions, natural and artificial, and I gave you the examples of all those. Okay, so that's how we classify the immunity, and knowing this is very helpful. Okay, Phagocyte mobilization, how the phagocytic cells move to the site of infection. We talked about this before when we talked about the white blood cells. Let me just briefly go over again. So this is the tissue. These are the cells in the tissue, and you got infection here. So microorganisms got here, and microorganisms have infected the tissue. So tissue will release chemicals here. Okay, so in response to that infection or inflammation, the tissue will release chemicals. Chemicals are released from the tissue, from the infected tissue. Okay, so the important chemicals here are histamine. Probably all of you have heard histamine, right? Another is bradykinin. Okay, and prostaglandin or PG. So those are some chemicals that are released when your tissue gets infection or inflammation. So this is the site of infection or inflammation. So when you get infection, inflammation occurs and these chemicals are released. Now, the white blood cells, those pass through the blood vessels adjacent to that site of inflammation. These white blood cells can sense that outside of the blood vessel the tissue got inflammation because the chemicals have been released there. Okay, so these white blood cells, instead of passing through the blood, will get attached to the wall of the blood vessel, and that is called margination, lining up. Then in the wall of many blood vessels, especially in the venules and capillaries, you have pores or holes. Okay, so the white blood cell will squeeze out through the pore, tiny holes, and that process is called diapedesis. Diapedesis is the process by which the white blood cells squeeze out through the tiny holes in the wall of the blood vessel. Okay, and once the white blood cell comes out, it will start to move towards the site of inflammation. Okay, how the white blood cells move? They move like the movement of amoeba. Amoeba, single cellular, organism. Amoeba produces footstep extensions and move from one place to another place, and that is called amoeboid motion. Motion like amoeba, amoeboid motion. Okay, so the white blood cells will move like that. Where? Which way? Towards the site of infection or inflammation. And why the white blood cells will move that way, not to the other way? Because of these chemicals, right? The change of chemical environment here, and that attraction is called chemotaxis. Chemical attraction, chemotaxis. Okay, so those are the steps how the white blood cells uh, you know come out from the blood and arrive in this site or area. Then finally the white blood cells will do what? Will do phagocytosis, will engulf the microorganisms or dead cells from the site of inflammation. Okay. Now I have already mentioned that adaptive defense or immunity is highly specific, systemic. Why? Systemic means it circulates throughout the body. Antibodies, right, and lymphocytes, they go everywhere. So not localized. For example, your mucous membrane or mucosa inside the respiratory tract and GI tract, those are fixed, will stay there, will not move, will not go to the other place of the body, right? So it is localized. However, the antibodies and lymphocytes, they are systemic. They circulate throughout the body, distributed throughout the body, right? And has memory. This is very interesting, that your adaptive immune system has memory. You have T memory cells and B memory cells. So you have memory cells in the adaptive immunity. You have T memory and B memory cells, and uh, they do what? They keep information of previous exposure. Like if you had certain virus before, uh, when you get it first time, the T memory and B memory cells will keep record of it. Okay, so these are antigen experienced cells. So when second time the same type of virus will try to invade into your body will respond very fast, quickly, will be able to destroy that antigen quickly. That's why we say that second time the chance of getting the same virus or microorganism is less, at least for next few years, as long as these memory cells are highly active. So however, innate immunity doesn't have the memory. Your skin doesn't have any memory. It doesn't keep any record, right? Who tried to invade before uh, or earlier. So these are three, properties of adaptive immunity, uh, and uh, how the adaptive immunity is different than innate. Okay, so we already talked about two branches of adaptive, uh, T cell mediated, B cell mediated, cellular and humoral, right? We talked about that. You already know that B cells, B lymphocytes get immunopotent in the bone marrow. We talked in last class that the lymphocytes are produced in the bone marrow. All blood cells are produced in the bone marrow, right? And the lymphocytes, those are produced first. They are naive. They don't know how to fight. Then some lymphocytes will go to the thymus and will become matured there, immunopotent there. And when they will come out from the thymus, they will called T lymphocytes or T cells, and those will get matured in the bone marrow and will come out from the bone marrow. Those are B cells. Makes sense, right? So T from thymus, B from bone marrow. And then they will enter into the lymphatic system, and will be housed inside the lymph organs. You remember we talked about those lymph nodes, thymus, spleen, tonsils. Those are heavily filled with T and B lymphocytes, right? So lymphatic system, uh, will get them. So they will enter into the lymphatic system and will be housed inside the lymph organs. Okay. We have already talked about two types of humoral, right? Uh, Active and passive, and active and passive both have natural and artificial. We have talked about that. So this is how the humoral immunity is uh, classified. First, active and passive, and both have natural and artificial, and I gave you the examples. Okay. Antibodies are produced in response to antigen, and the antibodies are actually proteins. And proteins, there are many different types of proteins in your blood. You remember, you have albumins, globulins, fibrinogens. Those are the main proteins in the plasma of the blood, right? So the antibodies are globulins. Okay. And what kind of globulins? Immunoglobulins, because the globulins give immunity. That's why this type of globulin is called immunoglobulin, which is gamma globulin. Okay. And mostly secreted by the plasma cells, one type of B cells. So B lymphocytes secrete a small amount of antibodies, but uh, some B lymphocytes are converted to plasma cells, and so this is one type of B cells, and they produce plenty of antibodies. Okay, plenty of antibodies. Okay, now antigens must be able to bind with the antigens. So if this is an antigen has harmful sites. For example, this one has few harmful sites. When you fight with somebody, your harmful sites are what? Or your enemy's harmful sites are their hands or legs. Or if they bite, their mouth could be also harmful. So you fight with those organs or parts, right? Hands, with your legs you kick or you can bite. So this is an antigen. Okay. And these are the harmful sites of this antigen. So usually antibodies are Y or T shaped. Okay, so the globulin, gamma globulin, Y or T. So this is Y shaped. These are Y shaped antibodies. So these are antibodies. Okay, so these antibodies will get attached to the antigen in a way that it blocks or masks the harmful site. Another antibody here, so Y shaped like this, you see. So it is covering or masking the harmful site. Another antibody. Okay, so they mask or cover the harmful sites. However, to do that, they must get attached to the antigens, right? So, and this is now called antigen antibody complex. So for the antibodies to work, this is important that antigen antibody complex is formed. Once the antigen antibody complex is formed, a number of uh, ways that can destroy or inactivate the microorganisms. For example, this is blocking the harmful sites. It can also do what? It can produce pores or holes, open the channels in the cell membrane of the bacteria or enemy cell. Through the pore, then water will get in and will cause the lysis or breakdown or burst of the bacteria or enemy cell. Okay, so that is another way the antibody will uh, destroy the antigen. So once the complex is formed, then different ways the antibodies can harm the antigens or destroy the enemies. Uh, so antigen antibody complex. Now antibodies, if you see the structure of an antibody, um, as I have already mentioned, usually T or Y-shaped monomer or 4 looping linked polypeptide chains. So there are 4 polypeptide chains. 2 are called heavy chains because they are bigger, and 2 are called light chains, they are smaller. And each heavy and light chain has a constant part and variable part. Okay, so each heavy and light chains have those 2 parts. We'll see that. uh, and antibodies could be different types, but 5 are more common: immunoglobulin M, immunoglobulin A, immunoglobulin D, immunoglobulin G, and immunoglobulin E. So A, D, G, E, M, those are 5 different types of antibodies. Those are most common type. There are more. Now you see the structure of an antibody. So 4 chains. You see these 2 are heavy chains, right? Because they are long, and these 2 are light chains. However, each of those 4 has a variable part, the end part, and constant part. So deep colored is the variable, and light color is the constant part, fixed part. Also this one, this is the variable, and this long part is the fixed part. Okay, so the fixed part is the constant part, and this part changes. Now why this part changes? Because this part gets attached to the antigens. So you see antigen binding site. So the variable part uh, gets attached to the antigen. And now why that part is variable, just think this way. In your car you keep a toolbox, right? And if you see that toolbox has only one shaft or handle. However, you have the opener or bolt many different sized, right? Some are small, some are big to open the nuts, and all these will fit here. So you can change, replace, but you don't replace the shaft, right? You keep the handle or shaft, same one. That is efficient. So only by changing this you can fit it with the uh, nuts. So same way, you see that fixed part is constant part that will not change, so that is like this. And variable part, by changing the variable part, the antibody can perfectly bind with different types of antigens. Okay, so by changing the variable part, the antibody would bind perfectly or fit perfectly with the antigens, different types of antigens. So that is efficient way to work. Now once the antigen antibody complex is formed, uh, three common ways the antigen antibody complex uh, neutralize or inactivate or destroy the antigens or enemies. One is by neutralization, another is by agglutination, and another is precipitation. However, there are other methods to destroy the antigens, but these are the common methods. So let's see. You see that antigen antibody complex, antigen antibody, okay, and these are the antibodies, right? And I explained actually this method called neutralization. It will block the harmful sites. The antibodies, they will block the harmful sites of the antigen. So this is the antigen and these are the antibodies, will inactivate or neutralize the antigen. So it will not be able to harm. Like if I tie someone's hands, legs, and uh, mouth, then the person will not be able to fight. So that's the method called neutralization. Agglutination, you remember on the surface of the red blood cells you have antigens, A antigen, B, D antigen, right? And those determines the blood type. So on the surface of the red blood cells you have the antigens. So if any mismatched red blood cells enter into your body, your blood type is different than the donor's blood type. So the antibodies in your plasma will bind with these antigens, right? And will you see here, they will bind with the antigens on the surface of the red blood cell and will cause clamping. That is also called agglutination. Okay, so the blood clot will be formed, uh, and that is called agglutination. So that is another way antibodies will work, will destroy these harmful blood cells that have antigens, uh, harmful antigens for your body. Precipitation. It is like, if you tie many people together with chains, then they will not be able to freely move. So antibodies will tie many antigens together. Okay, so they will not be able to freely go to the other areas of the body, and that is called precipitation. Okay, so increases the weight, so the whole complex is heavy now, so will not be able to move. So those are three common methods how the antibodies uh, will neutralize or inactivate the antigens. Now antigen antibody complex can activate a protein that is called complement. So this is a complement protein and this is antigen antibody complex, right? Antigen antibody complex. So this antigen antibody complex will activate this complement. This is inactive and this is active. Okay, so that active complement will do what? This is the bacterial cell wall. Okay, so if this is the enemy cell, your bacteria or your cancer cell or tumor cell, that activated or active complement will do what? Open the ion channels or pores that I mentioned before in the plasma membrane of the bacteria or antigen. Okay, so for example, this is a bacteria. So what will happen when the channels will get opened? The water will get in. Okay, easily water will get in and will cause the burst of the bacteria or enemy cell. So water will get in and cause lysis or breakdown of the cell membrane, okay, of the bacteria. So this is a bacteria. So that is a way your antigen antibody complex also works by activating the complement, and the complement opens the channels. Antigen antibody complex will also enhance the inflammation. So inflammation will be enhanced. Now inflammation is actually helpful for your immune function. Inflammation. Why? Because just think that in this area you got inflammation. You remember a few minutes ago I said that how the white blood cells get out from the adjacent blood vessels, right? So inflammation let the white blood cells, mobilize or move towards its site. So it is inviting the white blood cells, and white blood cells are doing what? Destroying the microorganisms, and also the dead cells. So that is helping to actually heal the injury at the site of infection. So inflammation is actually helpful. Similarly, fever. When fever occurs, the mobility of the white blood cell increases. So inflammation, fever, those are actually to help your body, okay, to heal or fight against the antigens. Uh, at the site of inflammation, you remember I said the chemicals are released, and one is histamine, and in the tissue you have the blood vessels, capillaries. So what happens? One, I have mentioned that white blood cells will get out and will enter into that area, right, to destroy the microorganisms. So that is very helpful. Also, histamine causes vasodilation. Vasodilation or dilatation. So when vasodilation occurs, the blood vessels dilate, get wider, so more blood arrives here, right? More blood reaches here. So more white blood cells will arrive there too. So increases the blood flow, and that's why you see redness and swelling at the site of inflammation. So these are helpful. Okay, and antigen antibody complex also stimulates the phagocytosis. The phagocytic cells, macrophages, will be stimulated, or cytotoxic T cells. They will engulf. They will be stimulated to engulf the antigen antibody complex. You see antigen antibody complex here. Whole thing is engulfed by this phagocytic cell, and that these phagocytic cells will be more active when the complex will come close to them. Okay, so that's how the antibodies fight the antigens. Now, you remember that there are two types of cells, T cells and B cells, right? So let's talk a little bit about those. So T cells could be four different types. One type of T cell is called cytotoxic T cells. Cytotoxic T cells are also called natural killer cells. Natural killer cells. Uh, Another type of T cells are helper, called helper T cells. Okay, and then another type is memory T cells and suppressor T cells. So those are four different types of T cells. Okay, I'll just explain briefly how they work. Cytotoxic, this one, natural killer cell. This is a cytotoxic T cell. Okay, and this is a bacteria or enemy cell. It could be your cancer cell or tumor cell too. Enemy cell. Okay. So cytotoxic T cell, when it the microorganism or the enemy cell comes close to the cytotoxic T cell will release a chemical that is called perforin. And perforin will get attached to the wall of the enemy cell, will get attached to the wall, cell wall, and will make holes in the wall. So the holes will be formed in the wall or pores. So perforins will do what? Will get attached to the wall of the enemy cell and will make pores. And then the cytotoxic T cells will release another type of chemical, and this chemical is called granzyme. They will enter into the enemy cell through those holes or pores. Okay, so these are called granzyme. Okay, so the granzyme molecules will enter into the bacteria or enemy cell through the pores and will stop the metabolism of that cell. Stop metabolism inside the bacteria or that cell. So the cell will die. The enemy cell will die because metabolism is essential for life, right? So that is how the cytotoxic T cell works. Helper T cell. Helper T cell will do what? Let's write here helper T cells. This is the helper T cell. Okay, and the helper T cell to work, you need another type of cell that is called the antigen presenting cell. So this is the antigen presenting cell. Okay, and this is the antigen, the enemy that should be destroyed. Okay, so the antigen presenting cell, you just think the name of it, it presents the antigen to the helper T cell. Okay, so this is the helper T cell. So antigen presenting cell will bind or hold the antigen and take it to the helper T cell. Okay, present it to the helper T cell, and when the antigen is presented uh, to the helper T cell by the antigen presenting cell, the helper T cell secretes a powerful chemical that is called cytokines or cytokinase, and this chemical stimulate the T and B lymphocytes, T cells and B cells. Both wings of acquired immunity will be stimulated. Okay, so they are stimulated, activated. Okay, both T and B. So both wings of acquired immunity will be uh, stimulated or activated to fight against the antigens. So this is how the helper T cells work or help to fight. Now memory T cells, I mentioned before that adaptive or acquired immunity has memory. It can keep the information of the previous exposure. So when second time the same antigen will try to invade, your body is already ready. It has memory cells, and they will quickly identify it and will produce antibodies that will fight against them. So memory T cells are called antigen experienced cells. In one nice sentence you can say antigen experienced, right, cells. So that is another type of T cells. You also have memory B cells or B lymphocytes. Suppressor T cell, very important. Its name is giving you some idea. Suppressor T cells are also called regulatory T cells. Okay, uh, it suppresses the immune system. Now, sometimes your immune system becomes hyperactive. Hyperactive immune system may not be good. Okay, you need normally active immune system. So sometimes what can happen, the immune system in your body uh, may function too much than your body needs. That is the hyperactive immune system, and uh, or hypersensitive immune system. Okay, immune system. So what is the problem of having hyperactive immune system or hypersensitive immune system? uh, this can start to treat your healthy cells as antigens or enemies, and that is a big problem, right? If your immune system start to consider your healthy cells as antigens because it is hyperactive, so they will start to destroy the healthy cells, healthy body cells, and that is called autoimmunity. Your own body's immune system is now working against your healthy cell. Autoimmunity. Normally it's supposed to destroy the enemy cells. And autoimmunity can lead to autoimmune diseases. Probably you have heard autoimmune diseases. So if the symptoms start, autoimmune diseases due to autoimmunity. For example, rheumatoid arthritis. Very commonly heard, right? Arthritis. What it does, it starts to destroy the soft tissue around your joint. So normal tissue uh, is being attacked by the your own immune system. Myasthenia gravis. There are many different, lupus, autoimmune disease. Now, the suppressor T cells will do what? Will try to stop the hyperactive immune system or suppress the hyperactive immune system. So that is happening inside the body, right? So to protect your body. So suppressor T cells will suppress the hyperactivity of the immune system, and that's why it is also called regulatory T cells or suppressor T cells. So these T cells are telling your immune system to come down, right? To take a break or rest. Time to take a rest. Don't be hyper. So that is how we see the T cells, different types of T cells work. Okay, so now let's see if anything else. So we have already, talked about cytokines, very powerful chemicals. We have talked about the uh, complements, right, activated by antigen antibody complex, and makes holes or pores and destroy the enemy cells. Another chemical that is called that is called interferon. Interferon. This chemical is also a part of immune system. These are viral infected cells. So these are the cells, infected cells in the body. So viral infected cells. The viral infected cells of your body uh, releases this chemical called interferon, and this is the healthy tissue, so nearby healthy cells. So the interferon will alert the healthy cells, okay, and healthy cells will release the chemicals that will stop the proliferation or uh, multiplication of the virus. So this is being studied to use against the virus, like a new type of virus when comes that we do the study to use this interferon to stop the proliferation of the virus, okay, like coronavirus or SARS or other swine flu. So the multiplication of the virus can be stopped or suppressed by the interference, so to protect the healthy cells. So that is one thing you need to know. The last I want to just introduce one term that is called opsonin. Opsonin, the word came from Greek word that means side dish during your dinner, okay. So opsonin is a protein that is used by the immune system. This is the antigen, okay, and this protein will get attached to the surface of the antigen, okay, and will make the antigen delicious to the antibodies. So opsonin, these are opsonin proteins, will get attached to the surface of the antigens like this, and will make the antigen more what? Tasty, delicious, okay. So will give sweet coat around the antigen. So antibodies or phagocytic cells, uh, phagocytic cells, macrophages will love to eat them, engulf them, okay, and that process is called opsonization. Opsonization. So opsonin will is like a side dish that will make the antigens more engulfable or eatable or tasty, delicious for the phagocytic cells. Okay. Um, so that is something interesting. Anyway, so that's all about the immunity. So it is a very important topic, and immunity is a huge, vast subject. So a lot of things we didn't cover or touch. Um, However, I think this will give you a basic, idea how the immunity in your body works. Okay.